Hi everyone, welcome back to the Spinal Surgery Survivalist channel. I've had 3 back surgeries over the years, and what I can tell you is that physical therapy is what has made all the difference for me. It has helped me to manage my back pain and stiffness over the years, and was instrumental in preparing me and getting my body strong for the fusion surgery last year. And since the surgery, I've come back stronger than ever before. These are the exercises that have made all the difference, and I believe in them because I've lived the results myself. Whether you're dealing with back pain and you're looking for ways to alleviate that pain through movements, or you're preparing to go into surgery, or it's that 12-week mark post your surgery when you're allowed to bend, twist, and lift again, or even if you're just interested in spinal health, these are the movements for you. I've recorded this video with my amazing biokineticist, Tiana, and she has planned a program that splits the exercises into 3 categories. The first being foundation, the second being strength, and the third being mobility. We have put them all into this one video, but it has also been broken up into 3 separate videos in case you just want to focus on one or the other on a particular day.
Hi, my name is Tiana Rabie. I'm a registered biokineticist. I work with people in a rehabilitative setting, so we prescribe exercise as medicine, whether that's for chronic or orthopedic conditions.
What I know for sure is that when we understand why we do exercises, we're more likely to actually do them. Our foundation exercises focus on correct form and posture so that you know how to balance your hips and pelvis in everything you do. By doing this, you're less likely to put unnecessary strain on your back muscles and spine. The strength exercises target the deep core muscles, the glutes, and the hips. This provides our body with a solid base to make sure that you're using the correct muscles when you move to protect your spine and improve balance and control. The mobility exercises are aimed at reducing stiffness in the body so that your joints can move in their full range of motion. By doing this, you're less likely to overuse some muscles, which ultimately causes pain, strain, injury, and instability in your body. Please remember to stay within the limits of mobility and pain. And if any of these exercises are giving you any level of discomfort that concerns you, stop them straight away. Rather speak to your doctor or physiotherapist to find some alternative movements that will suit your body condition better. We heal through movements, so let's get started. Since I've had my back fusion, I've learned that just by adjusting my pelvis into the right position can ease so much of that deep lower back ache. The correct position of the pelvis actually stops the back muscles from pulling the wrong way and instantly improves overall balance.
Okay, so we're going to start by placing the hands on the pelvic bones or the hip bones to help us guide through this movement. So we're going to start with the anterior pelvic tilt, in which we're rolling the hip bones anteriorly or forward, so away from the body, which will create a slight curvature in the lumbar spine or in the lower back. And then from there, we're going to roll posteriorly or backwards, bringing the hip bones closer in, flattening out the back, and almost think of tucking the tailbone between the legs. With this, we also want to add breathing, so we're going to inhale as we roll anteriorly, expanding the chest, and then exhale to roll posteriorly, planting the back flat on the mat.
If you want to know how to unlock your body's hidden superpower, then learn how to do deeper core activation. These deep core muscles quietly stabilize and protect the spine, creating an internal suit of armor, which also helps to manage back pain. The best bit is that you can do this exercise anywhere and at any time.
I want to encourage you to find a neutral pelvis, so not all the way forward or backward, but somewhere in between that's comfortable to you. As we're lying in this position, we're going to start with the upwards activation. Almost think of pulling upwards with the pelvic floor muscles as if holding in a wee or wind. And then secondly, we're moving on to an inwards pulling. That's almost thinking that we're sagging the navel towards the spine, creating a little bowl in the stomach. And then thirdly, we're going to add the breathing with that. So we're going to inhale for preparation, so fully relaxing, inhale, expanding the chest, and then exhale as we couple the upwards and inwards activation. So inhale, prepare, and exhale, activate. Important with this activation is that you're not pushing the back into the mat as you're activating, and you're also not bracing by pushing out the stomach. So we want a soft, soft activation.
A common habit and common cause of injury is bending using the back instead of the hips. Once I learned to hinge from my hips, I realized just how much I was now protecting my spine in everyday movements, like lifting up heavier objects, loading the dishwasher, and even when I brush my teeth and wash my face.
We're going to take the dowel behind the back, and we're going to make sure that we have 3 contact points: the head, the upper back, and the bum or the glutes. We're going to stand with the legs hip width apart, and then from there we're going to bend from the hip, making sure to maintain all 3 contact points, and then also coming up back into extension. When we're bending over, we want to keep neutral spine, and we're thinking of lengthening in the hamstring as well as in the glute muscles, and coming back up you want to exhale and squeeze the glutes as you drive the hips forward. So it's inhale down, extending up as we exhale.
Our glutes and hamstrings are so important in everyday life. They're key for supporting and stabilizing your pelvis, which helps to protect your back. Now that mine are stronger, I can really feel the difference in my balance, whether I'm walking and running, lifting heavy groceries, or turning my body to get in and out of the car.
We've got 2 bridge variations that we now want to run through. We're going to start with the feet flat. We're going to inhale to prepare for the movement, and then as we exhale, we're activating abdominals and lifting the hips up away from the mat. It's important to squeeze the glutes with the lifting, and then that core activation is going to help us to prevent from arching the lower back. And then from there, we're slowly going to roll down all the way back onto the mat. So it's inhale, prepare, and exhale, draw abdominals in, squeeze glutes, drive the hips up, and slowly come down. The second variation of the bridges, we're going to anchor the heels into the mat. So it's exactly the same movement, now just digging the heels down as we lift the hips up. This will help engage the hamstring muscles a bit more as well. So it's still inhale, prepare, exhale, activate abdominals and push through the heels, and inhale, lower all the way down.
If you're looking to get more stability in your hips, then this exercise is for you. It strengthens the smaller glute muscles next to your hips and improves balance on one leg, walking stability, and side step movements like getting out of bed or getting in and out of the car.
You would want to start completely flat on your side on the mat, ideally with the hip bones right over one another. If it's difficult to maintain that position with both legs straight, you can bend the bottom leg. Otherwise, we'll keep both legs straight, making sure that you've got good core activation, just drawing away from the mat as if wanting to create a bit of space between the side of the body and the mat. From there, we're going to take the top leg straight up and down. Very important here is to not lift the leg forward, then we're getting more hip flexor work than what we are glute. So it's a straight up as we exhale and inhale to lower down. Exhale up and inhale down.
Have you ever lifted a bag of heavy groceries, a suitcase, or picked up a small child onto your hip and felt a bit of a pinch in your back as your body tipped to one side? This exercise builds your oblique side muscles, core, and shoulders so that you can carry more weight with much more stability, control, and confidence.
We want to make sure that when sitting up that we've got the elbow directly beneath the shoulder. From there, we want both legs bent and we're going to push up through the shoulder, lifting the hip away from the mat. Nice and strong in the side of the body as well as in the hip, and just holding that position for the given time. Nice and deep breathing throughout. Two other variations that you can try is if on the knees is too easy for you, then you can start by extending the top leg, just holding it out straight. Or if that is even still too easy, then just lifting that top leg, holding it there, making sure that you're not dropping the hip, so keeping it up nice and high.
This exercise makes use of deep core activation. It trains you to move your legs while keeping your pelvis, spine, and upper body stable. I find this so helpful when I'm out for a walk, climbing stairs, or stepping one foot at a time into underwear whilst getting dressed, without feeling that unpleasant tweak in my back.
We're taking one leg up into what we call tabletop position. From there, we want to inhale for preparation, and then we're going to exhale as we extend the leg further away from the body. The goal here is to try and keep the pelvis and the back as still and stable as possible. So it's inhale up and exhale out. That is whilst preventing the back from arching or losing proper core activation.
This is a gentle way to get the spine moving safely, helping to ease tightness, improve flexibility, and take the edge off that nagging back pain. When I've been sitting too long at my computer, this one is super effective for releasing the stiffness in my back, and even something as simple as putting on my socks becomes less of an effort.
We're starting in a 4-point kneeling position. In this position, we're starting neutral spine, so nice and straight back. And then from there, we're going into spinal flexion, which is a rounding of the spine. We're trying to think of pushing away from the floor, tucking in the chin as we do so. And then gradually and slowly moving into spinal extension, so almost think of arching the lower back. And we're just going to roll through those movements only as far as what you're comfortable and which is pain-free.
This exercise really opens up the upper body. When I have a wider range of motion in my upper body, movements like twisting, turning, and reaching feel easy and strong, and I'm not putting unnecessary strain on my shoulders and my back.
We're again starting in 4-point kneeling. We're going to place the one hand behind the head or the ear, depending on shoulder mobility. And then from there, we want to rotate the elbow towards the supporting arm. And we're also going to rotate outwards, opening up as much as you can and what is comfortable. And we're just going to ease through that movement, elbow towards arm, and opening up, thinking of rotating up towards the ceiling. This is predominantly an upper back rotation, and we're trying to keep the hips nice and still.
Have you ever experienced that deep, burning pain in your buttocks that you just can't seem to reach? It's often the piriformis causing trouble, and this stretch is here to help. It targets both the piriformis and the glute medius near your hip, helping to release tension and bring real relief.
So we're lying on our back, either on a mat or on the bed, wherever comfortable. We're going to cross the ankle over the knee, allow the knee to fall open as long as that's also pain-free. And then from there, we're going to pull the leg up towards us, still allowing that knee to open up to the side. What you want to feel is a stretch along the glute muscles on the side of the knee that's relaxing outwards. We're holding that, and then after a few seconds, you can relax and change sides. Another variation of the glute figure 4 stretch is done in a seated position. So we're going to cross the ankle over the knee, we're going to sit nice and tall, and it's a hinge forward, not rounding of the spine to get a stretch. If there's a stretch seated upright, that's also fine. This is as long as the knee allows it.
The hip flexors are a really tricky set of muscles. Some of them run from your hips down to your knees and others through from the front of your hips to the back. And when they're tight, everything can pull and ache. For me, it's my knees, my lower back and my hips because nothing moves the way that it should. I do this stretch often and it's always part of my warm-up before a longer walk.
We're starting with both knees bent to 90 degrees. For the first stretch, we want to tuck the toes in at the back to increase the stretching in the front of the thigh. And we also want to utilize our pelvic tilt. So we're going into a posterior pelvic tilt without leaning forward. We're pulling that hip bone up and we're feeling a nice and big stretch over the front here. And just holding that for the time prescribed. Then the second variation, we're going to relax the toe. We're going to take front foot further forward. And we're taking the whole body forward, trying to not arch in the spine. And we're sitting deep into that stretch, still feeling front of thigh. If you want, you can always hold on to something for balance.
Thank you so much for watching today. If you liked this video, please do like, subscribe, and share so that other people like yourself can find this information.